Now, in past years, we've always seen October, November, December, you start to see a real decrease. This time, I think because centralized intake had been established, we did not see the same kind of drop-off that we had been seeing before. As of yesterday, the state is now fully a centralized intake state. All regions are now a part of our centralized intake system. And in a moment, I'll give you more information about that. But I think what this chart shows is that if you build it, they will call. And Melissa showed the iceberg chart. And so with that iceberg, with the centralized intake, you start to see more people having access to the system and now making the phone calls. So we've had a real, a big jump in the number of intakes. This chart, again, shows the full scope of DFCS, what we call placement responsibilities. So this is a Child Protective Services responsibilities. This includes just investigations and family preservations. Melissa did a great job of setting the context for this. So again, as she mentioned, when we receive a report of abuse or neglect, we either screen it out, meaning that there's no allegation of abuse or neglect, or we do a screen in. If we screen it in, we're going to either conduct an investigation or refer for what we call family support services. As of April of 2013, 2012, DFCS moved to a differential response system. So either it goes through investigations, family support. Difference being, both are allegations of abuse or neglect. If we feel that there's reasons to believe the child is not safe, we will investigate. If it's an allegation of abuse or neglect, but based on the information we receive from the reporter and other analysis we do, we feel a child is safe. So we can refer the family for family supportive services. This chart is just showing investigations and family preservations. And so you can see, as she had pointed out, we are at our highest since before 2010. And the arrow is kind of pointing to where we are. As we do a breakdown and just looking at investigations and family preservation separately, so cases investigated, and at the conclusion of that, she mentioned either we're substantiating or unsubstantiating. After the investigation, if we feel that this family continues to need some kinds of service, but children are not in danger and they can remain home, this is family preservation, because our first thing is to ensure that we can maintain the integrity of the family if at all possible. So this is the point where, we're making reasonable efforts to maintain this family unit. So that's that blue line at the bottom, family preservation cases that we have conducted an investigation. Most of these have been substantiated, though some may not have been, but we maintain these cases open because we are providing services to the family. Parents may be attending substance abuse treatment, domestic violence, parenting skills programs, those kinds of things.
So they are all substantiated?
The majority of these are. There are some instances in which we may unsubstantiate an investigation and still open it for services. Because substantiating it, we're just indicating whether or not there's reasons to believe that the allegations were confirmed. But there are times when we may investigate a case, not find any reasons to believe that what they said was true, but because of our assessment of the family, they do need some services. So, but I would probably say 90 to 95% of those family preservation cases would be substantiated investigations.
Correct. The bottom line of the family preservation, that hasn't changed a whole lot.
That has not, and that is a huge question for us.
But you look at the other one, which is double.
Yes.
But the purple line, that's where we could have problems. I mean, is that?
Well, with the purple line, right, it's just active investigations. But let me just say also that at the conclusion of an investigation, either we may open up a family preservation case or children may actually come into foster care. So that's not, you don't see that reflected on this one. As we move over, and you will see the increase in the number of kids coming into foster care, they could have come from there.
Because down here, that's a change over the time frame.
Right.
But this is pretty substantial.
Mhm.
And that's a pretty scary trend. And what do you all think that means?
And I'll talk about that in just a moment. Some Melissa mentioned, but I wanted to say also again that what we've seen probably in the last couple of years is more children coming into foster care straight from an investigation. There was a time, I remember maybe 5, 6 years ago, we ran the data and saw that more children were coming in from family preservation cases. But from what we've been seeing recently, the majority of them are coming. We do an investigation, child comes into care. Exactly. So from this one, you can't draw that. But in terms of the increase in investigation, it's kind of as Melissa said, some of it has to do with the centralized intake system. And she kind of alluded to some of the rationale behind moving to a centralized intake system. First of all, we find out about more abuse out there because everybody has access. There's a 1-800 number, 1-855-GA-CHILD, and so it's easier for people. Also, prior to centralized intake, it was a county-based system. You contacted your local county office. So in some communities in particular, the case managers know those families, or you've been working with this family. And so you may respond a bit differently from in a statewide, centralized, more objective, independent side. You have no idea most of the time. You have no history with this family. Based on a number of studies that I read before we did centralized intake in other states, they mentioned that this is the same thing that they saw, that you will see an increase in the number of cases that come in and the number that you investigate, because now you have people looking at it from a very different lens. The other thing that we've done differently that I'm going to hit up on when I talk about safety response system is that we've professionalized the role of an intake worker. Prior to about a year, actually this was just in the last year, it had been customary not only in this state, but across the nation that the person who took intake could be anybody. Because you were looking for someone who could answer the phone. So, could be an administrative support person and all of that. But what we've recognized is that the intake is a critical piece of our work, and that's when the assessment actually begins. So we have gone through and trained all of our case managers who are doing intakes to be able to ask reporters the right questions in order to ascertain the information that they need. So some of this that we're seeing also has to do with that, since we did the trainings like August, September, October of last year. So now they have a heightened sense of what kinds of questions to ask the reporter. What I'm hearing from reporters is that, of course, it's going to take longer now to make an intake than it did before. Because before we were just getting basic information and you could be on and off the phone in 10 minutes or so. But because we're really trying to determine and get a good assessment of the family so that we can make a decision about, do we investigate? Is this a family support case? So I think because of that level that we've added to it in terms of training staff, we're seeing more of those. Melissa also mentioned the high-profile child death cases. So that also brings cases in, because anytime that there is a child death, there is going to be a reaction to that, both from the external environment in terms of more cases being called in, as well as within DFCS. Because now we're a bit leery, we are probably much more cautious, and we start to move toward, when in doubt, investigate. Judge Walker, thank you.
I have a question for you based upon my county. I would say that my family preservation numbers will always be flat because I have X number of family preservation workers, so they can only have so many cases. But my investigations, Ross is going to pull in people from every county and pull people out of management positions, and we're gonna do those investigations to meet our timelines. So in my county, that blue line's gonna be flat because I'm limited by the number of family preservation cases based upon the number of workers I have. But on investigations, we're gonna pull anybody and everybody to do what we've gotta do.
And when something like that is occurring, that's something I certainly need to take a look at, because our work should not be based on, the staffing patterns. But I think you're right in the sense that an investigation does scream an alarm. Let's go out and take a look. Family preservations, we started doing what we call a safety roundtable. And this is a process that Casey Family Programs initiated, similar to a permanency roundtable, where we sit down with a team to really go through and determine, why are we working with this family? Has the family done what they were supposed to do, and all of those things? So we did see some closures there, and because prior to probably, it's just been in the last 2 years that the numbers for family preservations really came down. I was looking at, I think, some 2008, 2009 data. We had close to 7,000 family preservation cases was kind of the average. So as we look at the opening and closures, it looks like we're opening and as closing as many as we open each month. But I think what you're saying is something that we need to really take a look at to ensure that we are providing the necessary services. But we are taking a deeper dive into this, because my hypothesis would be that there would be some uptake in family preservation. However, we did see the uptake in foster care, and when we went back to look at foster care, we saw that many of them were coming straight from an investigation.
Dr. Hill, I have a question in regards to this chart and the chart that is two back, which is the CPS inmates received, and how those numbers wouldn't correlate. So, for instance, in March, they just don't seem to match. It seems that there are times here where you're doing more investigations than you had intakes.
Yes, because this chart shows the number of active investigations. Our time frame is that we make every effort to complete an investigation within 45 days. So as you take a look at March, these are investigations that may have come in, intakes that may have come in December, January, and they're still open. So this is indicating how many are open at any given time. With the intake line, now what you will see as the intakes go up, investigations will definitely be rising. But an intake that came in March, you will see that if it remains open for the next 3 months, showing up here. Because as long as it's active, we count it. So that's the difference in terms of how the intake feeds into the investigations.
Dr. Hill, is there a risk stratification to this in terms of if you take your information?
Right, I was wondering if you triage it the way a suicide hotline.
And we've experimented with different things. When I came into DFCS in June 2005, we were unveiling what we call a risk assessment system. And before that, we had a structured decision-making that had that triage component. We are operating now from a safety response system, which we developed in concert with the Child Protective Services and Technical Assistance team, a national team that we worked with, that said this is going to be the best way to determine which cases to investigate, which to move to family support. So what we're looking at now, there are some factors there and some elements that certainly bring it higher. And so I think, and for instance, Judge Walker talked about substance abuse, mental health problems, domestic violence, right? So those kinds of things certainly bring it higher.